So our Q&A panel is our last part of our research conference today. And we've got Professor Khamis Elessi, Professor Masliza Mahmod, and Ms. Roba Khundkar. We're really happy to have each of you join us here today. So Professor Elessi is a neurorehabilitation and pain medicine consultant, associate professor and head of the evidence-based medicine unit at the Islamic University in Gaza. His impressive background includes being awarded the highest degree medical specialty in Palestine in physical medicine and rehabilitation. He's a great friend of OxPal and given previous research fellowship courses, which were very well received, and we're incredibly pleased to have him back. Professor Masliza Mahmod is the head of clinical trials group at the Clinical Magnetic Resonance Research Division of the Cardiovascular Medicine Unit at the University of Oxford. After completing her medical degree in New Zealand, she went on to receive a master's in internal medicine from Malaysia and also a PhD in cardiovascular medicine from the University of Oxford. Her current research includes the use of cardiovascular magnetic resonance imaging and spectroscopy for early detection of cardiac abnormalities, as well as novel treatments for a variety of cardiovascular pathology. And we welcome her to our conference today. And finally, our final member of the panel is Ms. Roba Khundkar, a consultant plastic and reconstructive surgeon, senior clinical lecturer in global surgery and associate education fellow at the University of Oxford. After graduating with a medical degree from the University of Oxford, Ms. Khundkar went on to complete additional fellowship training in Oxford, India, and Japan in sarcoma and limb reconstruction, microsurgery, and supermicrosurgery. Her outstanding work involves surgical care in active conflict zones and displaced populations, and she also collaborates with surgical and academic units in Tanzania, South Sudan, the Middle East, Egypt, and Bangladesh. So welcome to all of you today. I think that Shahad is, I'm not sure she's been able to rejoin, so I will take over. So if you just give me a second, and I will share my screen with you all.
Aisha, so I'm sharing my screen. I'm not sure if you can hear me.
Oh, we can hear you. You're back. Excellent. Please take over.
Okay. Sorry again about the internet.
Can you hear me?
Yes, we can hear you, Khamis. Okay. So thank you again, Aisha, for the introduction. And now we're going to start with the questions. At the same time, we're taking questions from you guys at the chat. So if you have any questions for either of our speakers, just send your question in the chat, directing it to one of our speakers, and we're going to take it from there. Okay, so our first question is, why do research as a medical student? I want to be a doctor, not a researcher. So can Dr. Khamis maybe start? Would you please?
Thank you very much. Thank you very much, Ed, for that question. My simple answer for that is today's research is tomorrow's medicine. I mean, whatever we do as a research today will be the foundation for tomorrow's intervention, new therapeutics, new diagnostics, whatsoever. But we have to make sure that we are doing research for good reasons and for better research and research that will serve humanity, not only for sake of doing research.
Okay, perfect. Does Ms. Roba or Ms. Elza want to add anything else?
Yes, I'd like to add something. I completely agree with Professor Khamis. It is, what we do today affects our future, it affects us, affects our patients, so it's really important. What I wanted to add was that what's really important for us is, and what's important for patients, is having clinically relevant research. So if you're a doctor, you will know what your patients need, you will know what your colleagues need, you know what is relevant today for each specialty that you're in, which is really hard to understand when you're not a clinician. So it's really important that doctors are engaging in research. You may not want to commit your entire career to it, but actually being engaged, being part of it, being part of research teams is really important to make sure we've got clinically relevant topics that are really important for our patients, because the literature is full of lots and lots of research papers and research work and big studies that are funded by big bodies that are actually of not necessarily always of use to clinicians or to patients. We want clinically relevant research, and that comes from doctors and nurses who are actually actively involved with clinical work.
In fact, I'd like to add another point into this question. I want to quote a statement by the late Dr. Dogman Altman, who's a famous statistician. And he wrote once in 1994 that we need less research, better research, and research done for good reasons. So yes, we are now enduring more diseases, more medical disorders, and we need to have effective interventions. And to reach this, we need a robust research that is done to discover new interventions and new diagnostics, and maybe new ways to prevent future complications or future deteriorations of certain diseases. But we have to do it properly. We have to follow the robust scientific method in order to reach that conclusion.
I agree completely, and I'm going to mention something that I learned from Sir Ian Chalmers, who you heard from yesterday, and I think he's on the list here today as well. But I remember I was doing a short fellowship in the Cochrane Centre while I was training as a doctor, and had the honour of actually meeting Sir Chalmers, who gave me some time. And I remember being quite stressed, going, well, I don't really understand statistics very well, and I don't really know how to do statistics. And something he taught me was actually, it's not really the stats. So as a doctor, you're not there to do the statistics. That's not really the important part of research. It's interpreting it, understanding what it means in the context of what you're doing. What does it mean for patients? What does it actually make sense? Is there any bias in it? And you're there to interpret that, and you do that with the background of being a medical doctor, and that's really helpful. Whereas I've got colleagues who are pure statisticians who can do the numbers really well, but they don't really understand what that means. Does it actually mean anything? They don't really understand that difference, which you as a doctor will be able to do and interpret. And it doesn't matter whether you understand the statistical side or not, you will understand whether it means anything real.
Wonderful, wonderful. And another thing that I'd like also to add is that most of the time we all become tempted to do research and more research. But sometimes if we just start our research with a systematic review, to know whether the research that we are attempting or we are intending to do has already been done. So it will save our time, our money, our efforts, and we will be able as clinicians to accumulate more data to assist it, to appraise the reliability and validity of that data, and maybe give it for future practitioners to follow that guidelines. So again, I will take that from the mouth of my beloved brother, Sir Ian Chalmers, that before doing any research, you have to start with a systematic review and end with a systematic.
That is such an important point, and I repeatedly see. I've done it myself, where you do a study that's not very good, and then you look afterwards into the research, into the literature, and realize someone's done a much better review and a much better study than you. So really need to start. That's literally has to be the starting point, doing a systematic review and doing it well. And again, that's where you, the doctor, comes in, because you can put it into context as to what it really means. And one comment I'll make about all of our speakers who are absolutely excellent today, you did all talk about using SPSS as your software, and you talked about a lot of those kind of regressions. And actually, I would focus less on what those p-values mean to numbers and figures, and really stand back and say, actually, what does that result mean in the question I'd originally asked? Does it even fit in? And that's something really important to look at. You know, for example, the excellence talk we had about psychological distress, and looking at that kind of, the result was something that, you know, female participants had higher levels of psychological distress. But you do need to, because, you know, that's what kind of the p-values were showing, but you do need to stand up and say, well, actually, the majority of the participants here were female. So how does that affect my results? Is this a real result, or is this a recruitment bias? So it's really important to look at that, and you can do that as a doctor. You don't need to understand, you know, all of the details of the stats or anything. You just need to look at that. You need to look at what, as Professor said, look at what other people have done, what else is in the research. Does your result fit in with what's already been seen?
Thank you so much, Khamis and Dr. Roba, for your inputs. Dr. Masliza, would you like to add anything? I've seen you and your mic more than once.
Sorry, can I, contribute? Can I
Yes, of course.
say, okay?
Yes.
So I agree with all those points, and rather than repeating, I like to just add from a slightly different angle. So the first question, why do research as a medical student? It's very hard to do research as a medical student because you have to focus on to acquiring the knowledge first, to understand anatomy, things like that. So what I think what should be done is, I think you are doing it already, is just to get exposure, early exposure during medical student to research, just to take part, involve your supervisors as part of the curriculum rather than just doing research per se. The reason being, as been mentioned, for future career, because of the knowledge gap, and to improve patients' care and that kind of thing. And I want to be a doctor, not as a researcher. I think nowadays, I think it's most people. I don't think nowadays you can actually survive just being a doctor. From what I'm doing, I'm a clinical academic, so I'm doing both clinical service and research as well. So I combine both work, which is actually more rewarding. So to become a doctor per se, I think it will be kind of boring after some time. A lot of my colleagues, they change, they want to become academic as well, because of after some time, you just doing the same routine, and then basically you are using the knowledge which is available from the guidelines. But what you want to do is to be there as a part of the research group, providing knowledge. So what happens nowadays, people tend to work together. We are clinician and researchers. We can create a team rather than become one person doctor researcher. So so that's how I feel.
Can I add to that? Actually, I think that's a really, really important point that you've brought up. In that, you said you're kind of doing both, and you're a clinician and you're an academic, and that's a really nice combination to be able to do both. And I think in an ideal world, we'd all like to do that. But I think what happens in reality in a lot of places is that a lot of doctors are just full clinicians, and you don't necessarily always have that support to do the research. Something that we saw in our first speaker, who said that, doctors don't get the support to do the CME. And what we find, again, I think that's not just an issue in Palestine, is that doctors who are not on an official academic contract are clinicians, but they also want to do research, but they have no support to do that research. So what I think we need to do is just make sure we have less of that divide, and as you say, have bigger teams where everybody's able to join in to do some research and have the support, even if they're doing a small part of it.
Yeah, I think I agree. That's actually a common problem, and not a problem scenario all over the world. So what tends to happen is we collaborate. So with the district hospital, for example, they take part in research, they contribute patients, recruitment, they become sites. So multi-center studies, so that rather than doing both. So, for example, I'm doing clinical academics, but I do work together with the people doing full clinical work as well. Recruitment, for example. So we do work. We collaborate with various centers. So nowadays, there are actually less and less people just working purely on clinical work. They will always have some research activities.
Yeah, I agree with that. But again, I would advise our lovely audience to read one article that we have published in The Lancet by the title, "We need to teach medical students critical appraisal more than to teach them how to do research." Yes, I do research myself. I supervise hundreds of students over the last years. But again, before embarking into doing research, maybe we need to learn on how to appraise, how to digest, how to taste the research findings. And after that, we can organize, plan our research in a clear, robust manner. before just embarking into any sort of research idea, like what we see lots of our junior students, medical students, medical graduates, they really want to do research and they just want to do any research just for sake of doing research. My advice for them, before you do, like my other colleagues in this session mentioned, students have to have a passion, genuine passion, to reach and report the truth and only the truth, not to produce more research, because every year we have between 3 million and 3.5 million articles published, according to a series of articles published by Sir Ian Chalmers and Professor Paul Glasio in The Lancet by the title Wastage of Research. They have estimated around 85% of produced research is wasted. Why? Because it has asked the wrong question, it has followed the wrong methodologies, it has used the wrong statistical test, and the interpretation and reporting data wasn't really honest and complete. And finally, the results were not disseminated, so nobody made use of it. So in order for us to be good researchers and researchers for good reasons, we need to plan research very, very delicately. We need to ask the relevant, clear question, and we need to use the robust methodology, formulate our objectives in a smart manner, and use the most suitable methodology to reach the most honest data, and then report it honestly, interpret it completely, and disseminate it as widely as possible. And that's, I totally agree and totally support such kind of researchers, because we really need researchers to give us answers. Just to give you one simple example, since the appearance of this COVID-19 in the late 2019 till this moment, more than 200,000 papers and preprints have been published. Do you know that less than 10% of it is genuine? Less than 10% of it really worth your time and effort to read. Many of it advise us to take wrong medications. Many of these medications even kill more patients than benefit them. So for my advice for our young generations, our young medical students, young doctors, yes, do research, but do it for a good, better reason.
Professor, I again completely agree with you, and I'm a real big fan of learning to do critical appraisal, and I think that is one of the most useful tools we have as clinicians to be able to advise our patients, and therefore, from a very early age, from medical school, we need to know how to read research papers, how to understand it. So you need to understand some research methodology to be able to do that. But I think my concern is, as you say, there's so many research projects done, Professor, worldwide, and it's not a problem just in Palestine or the UK, it's everywhere. Lots of projects are done. And the question is, why is it being done? Why are so many useless or inappropriately done research projects taking place? One of the answers for my juniors in the UK, and I kind of suspect it may also be true in Palestine, you would know better, is that as much as we say our medical students need to spend a lot of time learning research methodology and critical appraisal, that takes a while, that takes time. But our students and our junior trainees don't have that, because to progress in their career, they have to show they've done some research. So all the application forms for jobs in the UK will, as soon as you're a medical student, you want to become a doctor, you want to go into a field of surgery or something, it will say, how many research papers have you published? How many research projects have you done? You get extra points for doing that. And we've set up a system that forces them to do these quick projects before they've actually learned research. And that's our fault of the system. And I don't know if it's the same in Palestine, but it's certainly true in the UK, which is why certainly in my specialty surgery, there's lots and lots of very poorly done research projects that are published because of this push from our juniors trying to progress in their career.
Thank you so much, Ms. Sherbla. I'm sorry that I'm interrupting, but just that we have a lot of questions and we're trying to cover as much as we can. I'm sorry again for interrupting. That's such a wonderful discussion. I'm sorry again. So our next question is, I want to do research, but I don't know where to start. So can you please, Dr. Masliza, take it to this? What do you think? Maybe that's also related to one of the questions we had in the chat. So someone is asking what type of research we can start with. So, what do you think, Dr. Masliza?
So basically, before we go on which research, I think so first it's the exposure first, and then so at the moment, so what we've done in the UK for medical students, rather than jumping into doing research, so the curriculum is that medical students have exposure to sort of like critical appraisal about on papers, reading up about papers, and then also having exposure to clinical research. For example, I'm involved with the as a clinical research supervisors, for example. So I've got a group of students coming to me to see actually how research is conducted. So they have some ideas about different type of research. And then I think in terms of what's the best type, there is no such thing, the best type. It depends on the feasibility, what's available, and research question as well. So the simplest research, probably observational study, and probably the most complicated is probably clinical trial, for example. So again, it depends on what's available and the interest as well. But most people will want to do quick research and get papers. So that would be, I think that should be the way. I don't know whether I've answered the question. So please ask if you don't understand.
I think that was perfect. Miss Roba or Dr. Khamis, if you have anything to add on. Also the students, if you have any further questions on Dr. Masliza's input.
I think Dr. Masliza have given a comprehensive answer. I would just add to follow, stick to one of your senior supervisors or mentors in your school in order to be guided by his knowledge and his experience. So young students, young researchers can really mirror him or work as a shadow. But the issue here is how to choose your mentor and your supervisor, and that's really make a big difference in the success or failure of future researchers. Maybe we can comment on that. I don't know if I can comment.
I like to comment on that. So it's a very good question. So I can only share my experience. So when I was in my 4th year, very early medical student, I was in New Zealand before the research environment wasn't very good at that time. So what I did, I was curious. I wasn't sure. I wanted to do research, but I wasn't sure where to start. So what I did was I went to all the senior professors at that time, different department, asking for them whether they had any research idea, something ready for me to do as a summer studentship, for example. So I went to various people and I just which one I think is most interesting. Usually when you start, you will always want to start something easy meaning that within short period of time, or something that you can actually yourself do it, usually questionnaire or analyzing data, and also a topic that you think you are interested in, for example, obstetric or hematology. You must have something that you sort of like. For example, if you write surgery, you go to a surgeon, and then you narrow down, and then you know this is what I want. So that's would be my tips.
Yeah, that's a great answer. Actually, a related question that we have, I think we've answered it partially. So someone asked that they don't have enough time between.
Yeah, that's common. That's common that we don't have time or resources. But again, I go back to my previous comments. Maybe if you approach a senior advisor or senior mentor, he has the resources and maybe he has the connection, so he will facilitate these things. But I would like to expand my answer more into the quality of the supervisor or mentor that young students have to look after. First is the personality. So is that potential mentor or supervisor have an approachable personality, kind personality? Because if not, he will just just shy them away from that interest of them. Also about his seniority, but here there is a point that being more senior doesn't mean more knowledgeable in the topic. So you have to look for the more knowledgeable in the topic that you want to do research in. And also previous connections, if you, that mentor or that supervisor have taught you before or have supervised you in the clinics before, that he will be easier to approach. But also there is another angle here, which is the connection of that potential supervisor, university networks, his knowledge, his acquaintance with our professors, previous alumni. He can introduce you to more conference, more seminars to attend. That will make your research journey much easier.
Okay, perfect. Thank you, Dr. Khamis. Dr. Roba, do you have anything else to add? We haven't heard you in a while.
No, I agree with what Prof just said. I don't really have anything more to add to it. I think it is really important that you choose a supervisor well. And to some extent, my university tutor had told me that it's not what you're doing. The project itself is not the important thing. It's the being with the right supervisor and being with the right team is what's most important in research, rather than the actual project itself. I think that's really good advice.
Perfect.
So I agree that the relationship between supervisor and student is very critical. I agree that you need to find someone who's passionate and then has the time to help and then approachable. And then the more important thing is the person, the supervisor must have enough resources, projects, or support for the student. And also I wanted to mention about the time, asking about time. Time's always is like multi-million question. So I think if you like something, you will find time to do it. I think you have to when you look at the project, you usually will discuss, you look at the project that is easy, feasible. You will know whether you have time. So it's, usually it's always a discussion whether you have time to see what spare time do you have. For example, my previous project when I was in 4th year, so I chose the time when I was, during summer holiday, for example, or during the weekend or during break, for example, something that you can come and do analysis. So it's always something that you can discuss with the team, the research team, how much you can contribute.
In fact, here I wanted to add one experience. Many students really ask me, how can we approach the potential supervisor? How can we connect with them? And my advice to them is go by the formal, if not by the informal. You write an email that my name is so and so, I'd like to join your research team, or maybe you can call him, arrange for a meeting. Maybe you can introduce yourself during conference, seminars, or we have something called the elevator pitch. You just meet him in the elevator and you want to use it. You meet him in the corridor and you have only 1-2 statements to say to catch his attention to your research idea. So maybe you just, oh, hello, sir, my name is Khamis Elessi, and I'm planning to work in this field, this topic. Would it be possible for you to be my supervisor? Or I will be honored to be under your supervision. By this way, you catch the attention of that supervisor, or potential supervisor, I should say. So he will tell you, oh, why not? Just send me a formal letter, send me a full proposal. And from there, you start the ball rolling, and maybe you will have a chance to be under his supervision.
I'm reading the question now. I think doing research is not kind of interest among Palestinian students, but lack of support, lack of senior interested. That's a very common problem.
So we
think the answer is
we have
beyond
related question to Dr. Roba. So
Hello. Hi.
Hello.
Yes, we can hear you.
I think Majid, that's a really good question. And I know many of the surgeons in kind of around where you are. I think the difficulty with clinicians is something that I alluded to before. I think for both of the other speakers who are academics have that support to do research. For those of us who are pure clinicians, and that includes the surgeons in the West Bank, you know, your clinical work is very, very busy, and there really isn't the time added into your job to do research separately. So, but you know, nevertheless, lots of people are still doing it, but they're trying to just, you know, fit that in, and it is a real fine balance. And as you become medical students and doctors, you do need to learn to make sure you've balanced your work, your clinical work, your research, your home life, your personal life. All of that needs to be balanced finely, otherwise there is a real risk of burnout. And it becomes quite harder when you're doing a purely clinical job, and which is the case for many of my surgical colleagues in Gaza and the West Bank. But the advice still holds true of what both professors have just said to you, in that write to them, try and meet them informally, try and meet them in the elevator, because all of that still holds true. And, you know, if you meet me and I'm in the elevator and I say, look, I'm really busy, I don't have time for research, I might still say to you, but my colleague does, and I can give you the details of my colleague. So I think all of the advice that they've given you is still the same. If you love surgery, find some surgeons, go and spend some time with them. The best time to get a surgeon to talk is when they're operating. You know, go and say, look, I'm really interested in surgery, can I join you during your theatre lists? And spend the day with them, spend 2 days with them while they're operating. At one point where it's not critical, you can slowly talk about it. The other good time to talk to surgeons is in between cases. So if you've got 3 patients, you finish operating, you're waiting for the second patient, you sit down, you have a cup of tea, you make them a cup of tea, and you just say, look, you know, professor or doctor, so-and-so, I'm really interested in research. Is there something you could do? Or, you know, I know you don't have time, but I could do a lot of it. Could you supervise me? And so try and strike up those conversations, but try and join them in theatre. That's the way to get to know surgeons and do research with them. You are very welcome to write to me as well. That's also absolutely fine.
So Robert, actually, to add to your comment, it also holds true for clinical academic as well.
Yeah.
Because I'm doing clinical as well, so my half of that my time absorbed to clinical, service, and then even though I'm doing research, it's a busy research, so I find I struggle as well to fit in medical students. So I usually find those people who have more time, meaning that they sometimes they only have like 2 or 3 weeks. So I would actually entertain people who have slightly more time for me to teach more, so they can learn more. So I do struggle as well with time.
Yeah, no. I mean, you're trying to fit in 2 things, aren't you? You know, and often with someone like yourself, you're meant to do 50% and 50% of each, but you end up doing 80 and 80 for both, and it's a real struggle.
Yeah.
Perfect. Thank you, and I hope this answered your question, Majduddin. Okay, so moving to a question about submission. So when someone asked that they have submitted research papers and they've been working on their own papers, but they're never been accepted for publication. So if you have any tips and advices on choosing the journals and submission and publication, etc., that would be great.
Who would like to start first?
So do you like, if you'd like to start, Dr. Masliza, and then we can move on to Dr. Roba.
Okay.
So Khamis left the chat. Find her.
So paper submissions, rejections, it's a bread and butter. My papers rejected 90% of the time. I had my papers 2 years, 10 times rejection. So I think, so when they reject, they give you comments. Reviewers use that comments for the next paper, for the next submission. So always take on board on their comments. And always when you want to submit, first you decide which journal. I would usually go to a sort of like higher than what we expect. Be realistic, be sensible. If your findings are not that novel or interesting, don't aim very high impact journal. It will only disappoint you because you know that it's going to be rejected. So, you know, try something like probably moderate or medium or lower impact. So it's so that there's a high likelihood of being accepted. So the aim must be correct. So like, you know, not too high, not too low. And then use the comments to improve the paper for the next submission. And then I guess in the team, you've got various people in the team, so get everybody to contribute, and then get the best, the worst, you know, reviewers for like researchers in the team who are very, very critical. So get them on board, you know, to help them evaluate the paper. What else? So that's it, I think, generally.
Okay, perfect. Thank you. Do we have any further comments from Ms. Roba?
Hi, sorry. I would add that the paper issue, as you just heard, it's difficult for everybody. We all have rejections all the time, and you know, taking those comments into account when you get your rejection is really important. But I would go further back again. Both of my speakers have alluded to this, that you've got to do the planning for your research project with that paper in mind. So one of the professors I once worked with told me that he would, when he's planning his project, he would write the paper at that time. Okay, so you write a draft paper, you put in what you want to put in, and it's when you're writing that you realize what needs to go in your project, because you realize, because what we normally do is we do the project, we then come to write the paper, we realize that actually there are bits missing, or the question we should have asked was the wrong one, or we didn't ask, or there are bits of data we need, and the paper doesn't quite come together, and then you submit it, and of course the reviewers pick up on that and it gets rejected. So it is a really useful practical tip to try and write that paper or this potential paper at the very beginning, and then make sure your project is planned according to what sounds like a good project that's going to come together.
Perfect.
I would like to add to that. So for the planning stage, I mean, when you write when you have the data, the result of that will be too late. But when you actually plan, what I usually do is to think about all the negative things, the possible things that can go wrong. And then what would, you know, the worst case scenario, and then what if this like this. So you want to do your best and prepare for the answer in case reviewers will ask. So when we plan our projects, we will actually try to think as reviewers, think that as if that we are submitting a paper, as Roba said. So I agree that that's a very good point.
That's actually a really good thing. You said that's a really good thing. I saw something very funny once. I was watching a lecture given by someone high up in Google, and they said that when they start a project, they start it backwards, in that they almost form a team at the beginning to see how they can ruin the project, how they can kill it. It's like killing the project title they have, and they try and kill it, everything they can think bad. And exactly what Prof just said, you kind of think of all the negative things, and they do that at Google. So they say there's no point in us spending 3 to 6 months and lots of money on a project that's not going to work. So we try and do it backwards and think of all the negative things, all the things that can break and kill this project at the beginning, and counteract it at the very beginning. So that's a really good exercise to do.
Yeah, so because when at the submitting, you know, publication stage, reviewers will ask why this was not done, why is this like this. We will say, we thought about that. This is the reason why we're doing this, because we thought about this. So if you've got all these answers, so, you know, you usually will, basically reviewers, they want an answers why. So as long as you have plausible answers, that's fine. I think you will survive.
Perfect. Thank you so much. I just want to take a few moments to read out Sir Ian's comment out loud. Thank you for commenting as well. So Sir Ian says that people shouldn't feel apologetic if they don't fancy doing research, only if they don't want to learn how to spot bad. Sir Ian and it is possible to teach primary school children principles of critical approach. So Sir Ian was sorry. So Sir Ian, he was sharing in our city. He has published with colleagues in Uganda and Norway that showed that it is possible to teach primary school children the principles of critical appraisal and critically thinking. So it's not that something that you have to be an adult and in college to appraise on. Thank you, Sir Ian. And moving to our very last question, if no one has any further questions. So our last question would be, how do we go about choosing which journal to publish in? So if Ms. Roba, you want to start, go ahead.
I think it partly depends on what your topic is, doesn't it? It depends on your specialty. So if you've got a very subspecialized topic, then you've got to look for those subspecialty journals. If you've got something which is more of a wider topic, then you've got to think about the bigger journals, and as you know, we've heard earlier, go for something a bit higher to start with, and then you can work downwards with the lower impact factor, but do aim to go for a higher journal. So you've got to think about, you know, what subspecialty journal would be suitable, what bigger journal would be suitable, but you've also got to think about, do I want to, you know, how do I want this published? Do I want this published locally? Do I want it in a national journal? Do I want it in an international journal? So all of those things are things to consider. And then again, back to my old point of, think about this at the very beginning of your project. Which journal are we aiming for? What is it that they want? It has to be, you know, the planning of the publication, which is dissemination of your work, needs to be at the same time at the very, very beginning of your project. And can I also just emphasize one thing that Sir Ian has actually said at the beginning of that message, is that we mustn't feel apologetic if we don't feel like doing research, because, you know, we do want to be clinicians and research is really good, really important, but nobody should feel guilty if they feel like, well, actually, I don't really want to do research, I just want to concentrate on the clinical thing. But it is important that you understand research, even if you don't want to do it.
Could I have a brief word on that? Because it's a very important point. Would that be acceptable?
Good to hear from you.
Absolutely, go for it, Sir Ian.
Right, well, let's take Dr. Khundkar, for example. She's a surgeon. When you're faced with the possibility of having a surgical operation, do you ask for the surgeon's list of publications, or do you try and find out how good the surgeon is? And the point that I'm making is there's plenty of room for people to concentrate on things other than doing research. Understanding research is very important. And for example, it's not the case that there needs to be a deep appreciation of mathematics to help one use statistics properly. When I started to do my first substantial bit of research, I was working in the Department of Medical Statistics, and the professor put me in touch with a statistician to do the research that I was planning to do. His name's Robert Newcomb, was down in Cardiff. And I explained to him that when I was at school, I had actually left a calculus class in tears because I couldn't understand how to do calculus. And he said Robert Newcomb said a very reassuring thing. He said, mathematical ability is a congenital abnormality and most people don't have it, so don't worry. I thought that was nice, reassuring advice. So thank you for letting me have a brief say.
Perfect. Thank you so much, Sir Ian, for sharing your thoughts. And that's a great way to end our second day of the conference. Thank you everyone for joining, and I'm going to hand it back to Aisha for final words and thanks.
Thank you very much to all of our panelists and to all of the students who've managed to stay with us. I won't take too much more of your time. I just want to have 5 more minutes to wrap up what's been a really excellent 2 days. I just want to say 4 months ago, I interviewed for an interview to take over this job at OxPal, and then 2 months ago, I started running the organisation, and I was sat in a Starbucks and decided I wanted to run a research conference. And I didn't realize how much I had to learn when I made that decision, and perhaps I should have done what Roba suggested that they do at Google and written all the things that could have gone wrong and then work backwards from there. And maybe next time that's what I will do. But I think it's been an excellent 2 days, and I couldn't have imagined it going any better. So thank you very much to all of our participants, all of our students who've joined us, and for sticking with us up until the end. I know it's getting late in Palestine now, and some of you have had university today and things like that. And thank you to our panelists, to Ms. Khundkar, to Professor Mahmod and Dr. Elessi for joining us, and for Sir Ian for joining us again. It was lovely to have you back. And just a final thanks to my team. So the OxPal ambassadors, some of which are in attendance today, who've helped promote this conference all over their universities and helped us design it. To Shahad and Rebecca, who have been in attendance today and helping run everything. And then to the team members who aren't able to be here today, but who are featured in the conference booklet, which I keep banging on about. But I have to mention that a big thanks to the two students fourth year medical students, Mariam and Iman, who spent a lot of time making that booklet and putting it together so that the conference would run smoothly. And I'll close by saying that my take-home message from the conference, I had written this down before, was about an article that Sir Ian shared yesterday, how all healthcare professionals should begin their training by conducting a systematic review. But now I think my take-home message was what he put in the chat earlier, in fact, actually. And it's quite interesting to learn that, you can teach critical appraisal to primary school children, which means that we should all be able to pick it up fairly easily. So I'm going to end by asking you to fill in any feedback forms that might be in the chat. They really help us see what's helpful to you guys to learn, and to help us improve things going forward. And if you still have the energy to, I'd like to end by inviting you to put in the chat one thing that you would take away from the 2 days of this conference. Thank you again very much for joining us and for giving us your time, and we really hope you found it useful.